the world, 1 in 4 people will need mental health care in their lifetime. 43 million of those folks are right here in America. The World Federation of Mental Health put the spotlight on this issue 30 years ago by creating October 10th as World Mental Health Day. And tonight, 2 local groups are inviting anyone who wants to talk about improving their day-to-day to do just that in a town hall in Rancho Cordova. Live with me now, Dr. Gregory Giesler, Chief Clinical Officer of Sierra Health and Wellness Center. Welcome to Fox 40 News at 11.
Hi, good morning. Thanks for having me.
This is a really critical issue, and this year's theme for this day is making mental health for all a global priority. Confronting any mental illness can be a really isolating kind of thing. People feel so alone and like they're the only one. So emphasizing this is really a worldwide issue is really important, isn't it?
Yeah, absolutely. And I think events like tonight, any opportunity we have to provide education, make awareness of resources, provide extra support to the community is really important.
The town hall that you're working on tonight with OCA and North State University, you're hosting this in Rancho Cordova, will be touching not only on mental health, but also on addiction. People who may not yet be willing to pursue a diagnosis or accept their diagnosis may be self-medicating, right, with drugs or alcohol, and that creates a whole other layer of problems.
Absolutely. In the U.S. alone in the last year, 28 million Americans met criteria for a substance use disorder, but less than 10% actually obtained substance use treatment. And so being able to connect that bridge to help individuals who are struggling in this way actually get treatment is incredibly important.
That's just a really startling statistic that so few people are actually able to reach out for treatment. We know that sometimes there's just not enough places even for the people that are definite about wanting it. So it's definitely something that can impact the way that they're feeling day to day, and that self-medication with these other substances really obviously isn't fixing anything, isn't healing anything, and not getting at their real issues. Now, what message do you have for someone who may suspect that they might be experiencing a mental health challenge?
Well, I think as you mentioned earlier, stigma is a really significant barrier for individuals getting treatment. And so I think I'd like to let people know that, one, you're not alone. That there are many people out there who are struggling in this way. And I think one of the greatest displays of resiliency and courage is being able to reach out and to get help and support. And so while it might be something very scary to do, it's actually a great opportunity for incredible growth and healing, not only for yourself, but also for family. We see substance use problems being really pervasive across one's life, affecting how they view themselves, affecting their family, affecting their community. And so being able to take that step to get some support and treatment is a very human thing to do. We all need help. We all need support at various times in our lives. And so getting that help is a great display of courage.
It's one thing maybe to recognize that you do need that kind of help, or that someone that you care for needs that kind of help, but how do you have that kind of initial conversation with them? Because loved ones can also feel very helpless looking at someone that they care for deeply struggle and, you know, feel at a loss for how to begin that conversation. So what maybe do you say, what advice do you have for someone who maybe is seeing a loved one starting to struggle with their mental stability?
I think one of the things we've seen is that individuals who are struggling with substance use, they oftentimes lack awareness or insight into how bad the problem really has become. Most of the people who don't actually get treatment is because they don't believe they have a challenge with substances. And so I think one of the first things that I would recommend for a family or for a friend who's worried about a loved one is just being able to express to them what they're seeing from the outside looking in. To be able to express how their substance use is affecting them, affecting their work, affecting their school, affecting really just so many different parts of their life, and being able to, through, I think, kindness, through empathy, through some compassion, being able to share with them how these negative consequences are affecting this individual and affecting kind of their life in a variety of different ways. And so anytime we come from a place of love, compassion, support, I think that's a good place to start. And it helps to really tear down some of those initial defenses and barriers that could be preventing somebody from getting treatment.
I know that you are partnering with OCA, which is an organization that is focused on Asian Americans and Asian American Pacific Islanders. And I know that mental illness is sort of regarded differently in different demographic groups. So is that also something you're trying to get at tonight, to sort of break down those demographic sort of walls and perceptions about getting help?
Yeah, absolutely. I mean, I think we see those that kind of stigmatization of mental health and substance use concerns across the world in a variety of different ways. And I think especially for substance use disorders, we see that for sometimes as an individual as, oh, they've chosen to use substances. And so they deserve some less compassion or less empathy in those ways. And I think it really is upon us as professionals, as educators, to be able to reduce those barriers and that stigma, and to be able to help people recognize what a disorder of this actually is like, and being able to build bridges with the community so that we're taking care of one another. Mm-hmm. We have an obligation as a community to support one another in need. I think we saw that, really throughout the pandemic, especially, and how important the community is. And so being able to provide support to one another, especially in times of great vulnerability and need, is really important.
And if someone wants to participate in the town hall tonight, which starts at 6 p.m., what do they need to do? We're going to put up the registration link at the bottom of our screen, but anything else that they need to do besides signing on there?
I believe that's the primary way, is it's clicking that registration link and registering online and then showing up in person. I'm really excited to participate in it tonight. And I know Dr. Parikh and his entire team has done a really wonderful job on organizing it and making it available to the community. And so I think all are welcome.
All righty. Thank you so much. We certainly appreciate you coming in to share about this happening tonight in our community. Really important for people to be able to find and connect with this resource. Have a great day.
Wonderful. You too.